very good morning to all the participants of today's webinar. I, Dr. Sonali Akshay Tambewag, Assistant Professor in the Department of Pediatrics at Dr. G.D. Paul Foundation, Yerla Homeopathic Medical College, Kharghar, Navi Mumbai, extend my warm welcome to all the audience for today's webinar on clinical approach to learning disabilities with homeopathic management. Proceeding ahead with the webinar, today's webinar will going to focus on the most emerging topic of today's era in the pediatric age group, that is learning disabilities with its homeopathic management. So before starting, I would like to say a few words. Learning is a complex process which is very, very important to build a child's life on whole. In that, communication is an essential tool which will be connecting between the child, his parents, and his teachers. And this communication needs to be effective for a successful learning process in a child's life. But sometimes, in some cases, some disabilities may arise in children, which will prove to be hurdle in this effective communication. So, to discuss these difficulties, problems, which are termed as learning disabilities with the aid of homeopathy, today we have two eminent speakers for our webinar, that is Mrs. Bharti Kapoor Madam and Dr. Vinod Sawant Sir, who will be guiding to all of us on this most emerging topic in the pediatric age group. Before starting the session, I would have a sincere request to all the audience that kindly mute their microphones in between the session, and if they are having queries and questions, we will be having our question answer session at the end of the webinar. So I would request all of you to put your questions in the drop chat box, so that along with the name of the speaker, so that we will discuss it after the end of the webinar. So here we are now at the beginning of the session. I will like to introduce our first eminent speaker, Mrs. Bharti Kapoor Madam. Madam has done her MA in Clinical Psychology, MA in Education from Dr. D.Y. Patil University, completed her B.Ed in Special Education. Madam has 10 years of practicing experience as a special educator in the positive transformation of more than 200 children with special needs, which will be having ADHD, autism, and other learning disabilities. Madam has also worked as a partner and principal faculty at Gili Mitti Inclusive Preschool. Bharti Kapoor Madam will be going to interact with all of us on the topic clinical assessment of learning disabilities and its remedial education. So without wasting much time, I would request Dr. Bharti Kapoor ma'am to kindly begin with the session. Yes, ma'am.
Yeah, good morning. Good morning, everyone. Can you just check if I'm audible? Can you confirm it?
Yeah, yes, ma'am.
Yes,
Yes,
ma'am.
you're audible.
Good morning.
Yeah. I'm informed that this is a webinar for undergraduates and postgraduate students of homeopathy. Okay, so we begin with the presentation. Okay. So this presentation is from the clinician's perspective of the differently abled. Okay, there are different terms that are used for differently abled. We call them as special children, children with special needs, or gifted children. Uh, Through this presentation, the PPTs will cover what the special education requires and addresses. And I'll be talking about the psychological point of view through the presentations. A special education covers the following areas of special needs: intellectual disabilities, autism spectrum disorder, specific learning disability, AHD, cerebral palsy, hearing impairment, and visual impairment. Let me give you a brief background of what is special education. It is a program, it is a bachelor's program in education uh, with specialization in visual impairment, hearing impairment, learning disabilities, and autism. Okay, it's a 2-year program, and it's a complete professional program which is affiliated to Rehab Council of India. Now, in the field of clinical psychology, I would like to speak about DSM. DSM is a diagnostic statistical manual, which is, you can refer it to as the Bible, Gita, or Quran, okay, in common terms. This is a reference book which provides all the classification of the mental disorders along with the specifiers and the diagnostics tools. Based on DSM, the disorders are classified into the different heads such as ASD, uh, learning disabilities, or intellectual disabilities, which are revised every few years. Okay, the latest DSM is DSM-5, which is being referred for clinical practice right now. Uh, Before we start with the different disabilities, so we will consider the parents perspective also into this. Okay, now as disability is a big area and it is concerned with children, and it incorporates a lot of emotional, psychological, and family issues. Uh, when you have a child with special needs, okay, so it is a very difficult situation for the family, for the parents. So we will have this thing in a back of our minds, that the parents who come to us, okay, for diagnosis or for management part, are somewhere in one of the stages of the grief. Okay, so there are 5 different stages of grief. Initially, the parent is into denial, when you have a child, and when this is the biggest thing that any parent would look forward when you get married, to have a child, to have a normal child, to be with the child. But when you have a child with special needs, the first thing that you are into a denial completely. Then you go through the anger stage and bargaining, depression, before you actually come to the acceptance stage. So we have to consider this all aspects when we are dealing with a parent or a child with special needs. So now let us see the individual disabilities that we are going to discuss here. The first one is intellectual disability. Okay, the definitions, a brief definition here is, it's a neurodevelopmental disorder. Okay, and which begins in childhood, and the main characteristics are intellectual difficulties along with conceptual, social, and practical difficulties of living. The severity levels are based on the adaptive functioning and not just the IQ, which is a makes a big difference in this DSM-5. Okay, so maybe you have a IQ of say moderate level between 36 and 51, but if your adaptive functioning is good enough, then maybe you fit into the mild category. So you're not just the IQ score, okay, that is going to determine your disability rate. When we talk about intellectual disabilities, so they may have a genetic cause, a neurological cause, and environmental factor. So considering all the causes, the certification process which happens, it happens before the age of 18. Okay, and the certification process is important because there are a lot of rehabilitation services and the government grants that are associated along with it. So certification is an important process which happens at different centers, okay, across India. The next disorder that we are going to talk about is ADHD. Okay, when we say in a no little more casual way, we say that children here more of ADHD before they learn their ABC. So it is the most common neurodevelopmental disorder now, which is, one minute. So the main hallmarks of ADHD are, when the child has difficulties paying attention, controlling their impulses, and hyperactivity. So every disability is classified into based on their severity levels, which is true for ADHD also. So it has mild, moderate, and severe categories. Now, as per DSM, the change that has come up is that now it has specifiers with it. Okay, so it is inattentive presentation. If we see, if we have an hyperactive and impulsive presentation, or it can be a combined presentation here. The big change that has happened is here. Now another change. The age of diagnosis is extended from 7 to 12 years. Okay. The we can say because 7 years till 7 years the child is going through a lot of developmental phases, and it may happen that by 12 the child will overcome a lot of issues. So this is a good change that has come up with the DSM-5. uh, and now we talk about little diagnosis also here with ASD. Okay, so the diagnosis part here is based on the teacher's feedback that we get, the parents' feedback, and the clinician's observations during the assessment part. So there are some standardized tools that are used for the assessment and evaluation. Uh, and based on the assessment, you get a diagnosis of ADHD. Okay, now there is a brief picture which tells us about all the traits of ADHD. So there is lot of frustration that comes up. There is lot of inattentiveness. There's boredom. There's distractibility. Lot of anger issues. Then they may have behavior concerns. They may come up with conflicts. They may be fidgety. So these are some of the traits that we have to look into when we come across someone who is presenting these issues, or we have a parent coming to us and saying that, okay, now my child is very lost, forgets things, or loses things in the school, or has a lot of fights with friends and at, around, is distracted, is not motivated, or loses interest quickly. So these are the traits, or can call it as a red flags when we are dealing with children. Now, okay, next we go to ASD. ASD is the most emerging field of disability, and it is no, and the prevalence rate, high prevalence rate, makes it more for us as clinicians to look into and deal and create awareness about the disability. Now, as per the DSM-5, there is a change in ASD as well. Now we have an umbrella term called autism spectrum disorder, which includes autism, Asperger's, CDD, PDD, NOS. So earlier it was a separate category. Okay, Asperger's was diagnosed as Asperger's, PDD, NOS had a different diagnosis. Now everything will fall under autism spectrum disorder. Now, what are the hallmarks features of ASD? Let us see into that. The hallmark features are deficit in social communication and interaction. Okay, so this is the first deficit that we look into when we are diagnosing ASD. The second one is restricted repetitive patterns of behaviors, interest, or activities. So when we are looking at autism, we will see, okay, whether the child fits into these two hallmark features. The hallmark features will help us in assessing, evaluating, and diagnosing the child, and also planning the management part. Like other disabilities, it has 3 severity levels, which requires minimal support, requiring substantial support, and requiring very substantial support. Okay, again, there are some specifiers that we have to go along with the diagnosis. Okay, so there can be ASD with or without intellectual impairment. It can have accompanying language impairment. Okay, now here we can take the example of Asperger's. Okay, Asperger's will fall under a category with accompanying language impairment. Now, the next specifier is with neurodevelopmental mental or behavior disorders and with catatonia. Now we talk more about ASD here today. Okay, so when we talk about ASD, so we have done. Now let's talk about the diagnosis part. So for diagnosis, there are some standardized tools that we use. So the most commonly tool is CARS, Childhood Autism Rating Scale. Okay, that was widely used. Now we have an Indian tool. Okay, so I'm pleased to say that okay, now we have come with an Indianized version of autism rating assessment. It is called ESA, Indian Scale for Assessment of Autism. Okay, there are various domains, okay, areas which are assessed through this. It is a parent rating scale and it is a Likert scale. Likert scale means we rate is as you know always, sometimes, never. Okay, so it is done on observation as well as parent feedback. So based on the ratings, we assign a level for the child. Maybe the child is requiring support, requiring substantial support, or requiring very substantial support. So why is this, labeling important? We can say. Why is this labeling important? Because there are certain government reservations and certain facilities that are assigned for children with disabilities. So under the PWD Act, which is a Person with Disability Act, okay. So if you want to avail the facilities, you need to have your disability certification process completed. And for ASD, now looking into the education side, okay, why is this certification important? Now, if you want to get your child into a mainstream school, okay, so based on the scenario, current scenario that we have around, nobody would entertain a child with special needs into the school. So, and if you have your certification process completed, okay, so under the Right to Information Act, you can seek admission in the schools because you have certain quota. Okay, so this is the importance of registration and getting your child labeled in the sense getting a certificate for your child, disability certificate for your child. uh, Autism and early intervention, okay, are closely related because early intervention is the key to rehabilitation for autism. Now, what is early intervention? Early intervention is the period of therapeutic services provided to a child between the age of, say, 0 to 6 years. That is the crucial age when the child is into developing phase and there's a lot of neuroplasticity that is happening. So we can facilitate and let the child improve on certain areas. Okay. So what does the early intervention comprises of? It comprises of occupational therapy, speech, play therapy, and lot of counseling that goes into it. Now moving on. Now let us see what are the early signs of autism. Okay. So here we have two categories. One is the early signs of autism that we need to be aware of when we are dealing with our patients or parents, young parents, because the early signs can help us with the early intervention and a better rehabilitation. So, what are the early signs? Okay, now child is not responding to sounds and voices or names. So the parent may come as and say, okay, my child has some hearing problem. Should I go for a hearing test? Okay, but you need to then correlate. Okay, is the child providing eye contact? Oh no, the child is not providing eye contact. Then maybe the hearing test will not give us any results. Okay, is the child have showing some peculiar traits such as spinning or arranging objects in a particular manner, or not showing any interest, or doesn't like to be cuddled, or is the child is not babbling, okay, for that matter, or pointing to things as a normal child does. So we need to correlate all the early signs and then advise or guide the parent for the next step. Okay, these would be the early signs of autism. And what are the general signs of autism? Let us see. Now, some children have a strained attachment towards certain objects. Maybe they like something, a red cube or a blue cube, so that's their, they have a obsession, and they would just cling on to that object throughout. And if we try to pull away, then you have certain, inappropriate behaviors that come up. The child may inappropriately play with the toys. Okay, so playing with the car is fine, but the child is just observing the wheels. Okay, then is an inappropriate way of playing with the toy. So we need to look into all these areas. Okay, now the child may be hypersensitive or hypersensitive to certain sounds. Okay, a car passing by and the child may just scream. Okay, and there is a mixer uh, working in the home, and you may find the child, crying, and you are not able to understand what is happening to the child. Okay, so these are some of the signs that we need to look into. Now here is a more graphic presentation. Okay, so now ASD is a very complex disorder. Okay, so the basic hallmarks are like they have so language impairment, repetitive behavior, and social deficits. Okay, along with it, they may have intellectual disabilities, they may have seizures. So here we need to guide and advise the parents that they need certain other interventions as well. Okay, maybe they need a neurological evaluation, maybe they need to meet a developmental pediatrician for that matter. Okay, and the child may have to be put on under certain medication for the seizures. Now they have some psychological distress as well. Okay, as they grow. Okay, so the main disorder is that they are very anxious. Children with autism are basically very anxious about everything, so they may need some stabilizers. Okay, mood stabilizers. Okay, or some pharmacological help for their hyperactivity or sleep disorders that they have. Another important thing is it has been seen that children with autism have lot of GI disorders. So they need a referral to a GI then in that case. Okay. They may have reflux or constipation as parents complain. Okay. So we have to see all this. We have to keep everything into consideration when we are taking the history of the child. Okay. The case history is very important in autism because they may require help from different specialists. So they OCD is also part of it because they are very obsessed and they have this compulsive stuff, like they have to keep the things in order. If you remove, suppose there's a stack of books and you pull out one book and you just tend to keep it on top, but no, they will go back and they will just see to that the book is in its place and not anywhere else. So they have certain OCD, or they may just keep their washing their hands, or they may not like to walk bare feet. So they have certain obsessive behaviors that we have to deal with. Moving on, I will, if anyone wants me to repeat at any point in time, then please let me know. Okay, if I'm too fast or if anything needs to be repeated or explained, just let me know. Questions we can deal later. Okay. Next big area that we are going to talk about is SLD. Okay. Now SLD is a new term as per DSM. Okay. So earlier we are familiar, thanks to Tare Zameen Par, we are familiar with dyslexia, dysgraphia, and dyscalculia. Now specific learning disability is a new term that we get, and again, as all the disabilities are categorized, okay, they have mild, moderate, and severe levels. And with specifiers, okay, for dyslexia we say it is a impairment in reading, with dysgraphia it is written expression, and dyscalculia is impairment in mathematics. Now SLD also requires a intensive intervention plan. Okay, so here we have the services of occupational therapy required, neurological evaluation, speech therapy, and special education. Now, what is occupational therapy? Let us talk about briefly about occupational therapy. Okay, occupational therapy is the therapy provided to rehab the person, okay, into their regular life. So why do children with SLD need OT, occupational therapy? Because they have problem with their fine motor and gross motor. Okay, so what is fine motor? Fine motor is the let us take an example. Writing is a fine motor activity. Okay, so holding the pen, okay, developing the tripod grip is important to write well. So children with learning disabilities have difficulties holding the pen properly. Okay, so here the occupational therapy can help. They have a problem with coordination, gross motor skills. Okay, so they simple activities as throwing and catching a ball. It's a big task for a child with a SLD. So these areas are dealt by occupational therapy. Simple. Now we go to visual memory, auditory memory. Again, we need the help of occupational therapy here because they lack all these areas. Okay, so if you why are they finding it difficult to memorize tables? Okay, then why are they finding it difficult to memorize poems? Because they don't have that auditory memory developed. Hello. Yeah, so we move ahead. Okay, and as they grow on, they may have difficulties with time management, money management. Okay, so like occupational therapy, because they don't have the orientation or space. Okay, so left and right is a big challenge with them. So we need to address it as early as possible so that they overcome those difficulties. Okay, and otherwise driving is going to be a big task for them. They don't have that coordination of left and right. Time management, okay, so planning certain activities or how much time it would take, okay, for me to reach from X place to Y space. Okay, how do I plan? We plan it backwards. For them it is a big difficulty. So we need to have all these intervention therapies available to them, okay, so that their life becomes a bit easy. Now, when we talk about academic support is provided by special education. So, the three areas of the difficulties like reading, maths, and written expressions are covered with it. So, we'll be talking ahead about what is the academic help that a special education provides to them. Now, what is a counselor's or psychologist role in SLD? Hmm? So, the diagnosis part is the psychologist would undertake a standardized test for SLD. Okay, the commonly used tests are Woodcock Johnson battery, or the child will have to undergo an IQ assessment. WISC or WACE is undertaken for that matter. Then the child will have to also go through a informal testing done by the special educator, which is called curriculum based assessment, because the diagnosis of SLD is based on the grade level. Okay, it is not that the child is unable, because let us take an example. Okay, for here I would like to refer to the Einstein is supposed to be said that he had a learning disability, because earlier it was the achievement test that base diagnosed the SLD, but it is not now. Okay, you have to see the grade level. The child Einstein had a very high IQ, okay, but on the achievement scale he did not perform well. So now we have the academic levels. Okay, if the child is not performing at the right, suppose the child is in seventh grade and the child is not able to follow what is happening in the seventh grade, then we assess the child for a lower grade. Okay, we go to the sixth standard curriculum and syllabus and see whether the child is able to perform at that level. Maybe at reading, the child is able to perform at sixth grade. For writing, then maybe we go to the lower grade. We go to fifth standard and see, okay, the child is able to do fifth standard written work. So in reading, the child is at sixth grade. In writing, the child is at fifth grade. So similarly, we do the assessment for the maths part also. And we see at which grade the child falls into. So based on the CBA, the child will be diagnosed at which severity level the child is. Now, this is the complete diagnosis and certification. It is a very lengthy process when you look at SLD. Okay, so it may take somewhere around, say, 3 months to 6 months. Okay, when you start with your referral from your school and going to the center for getting your certification process completed. Now you take a referral from your school, then there is a parenting counseling that happens there, explaining you what are the pros and cons of getting the certification. Then there's a psychiatric evaluation because children with SLD may have certain emotional or psychological distress. So we have to rule out whether the child has anxiety or the child has certain, depression issues, which is stopping him from performing his academic skills. Then if the child has ADHD along with it, so the child will be put on certain medication for a brief period of time, and then the uh, formal assessment will be done. Okay, so the next step is after your counseling and your psychiatric evaluation is done, that the child is sent for a hearing and vision test. Okay, so we have to rule out, okay, whether the child was not able to see the blackboard properly, so he has not picked up the foundation skills that were required, or if the child had some hearing difficulties, so the child could not understand what is happening in the class and could not pick up the academics then. Okay, then there's a pediatric assessment and a formal IQ assessment is done, cognitive assessment. If the child has an average IQ, then the child is sent for a assessment for psychoeducation. Now, if the child has a IQ which is falls below the average range, then the child does not fit into an SLD. Then the child is referred for an intellectual impairment assessment. Then the case discussion is done, and then the parenting counseling is done to actually announce what is the level of severity to the parents, and then the support and complete guidance is provided from the certification process. In Mumbai, I would like to tell that KEM, Sion Hospital and IR hospitals are the center that have a learning disability clinic, and when your certification can be done. This is for people staying in Bombay, and for people staying in Raigad district, we have to go to our Alibag Civil Hospital, okay, to get their certifications done. Now here I would also like to mention that when child with SLD, a lot of emotional distress is created for the child as well as the parents. So that is a challenge when there are lot of concessions that are come along with your certification, but along with it you get a lot of emotional distress, because then your child is certified as having SLD. Then the first thing that the child sees in the school, that the child is attending the resource room or is going to the special educator, so the child is seen as a little different from others. So then there is this teasing happening in the school. Okay, now this child is going to the special educator, he's a little different, he's dumb, he's not able to pick up, so he's going to that room for special education services or for counseling. So there are a lot of emotional issues, so it has to be considered here that the child will require a lot of emotional and psychological support here in dealing with the assessment and diagnosis part. So these all things the parent need to take care of before they get into the certification. So here is where the counselor plays an important role for preparing the parent as well as the child for the diagnosis. Now, remedial education. Now, let's talk about remedial education. For this presentation, the remedial education is limited to specific learning disabilities. Okay, but remedial education as such is for all the disabilities. Okay, for autism, for ADHD, but the plans are different. Okay, when we talk about SLD, it has a different plan altogether. So, what is remedial education? Remedial education is not teaching the child uh, how how to read or how to memorize or how to comprehend. It is teaching the child how to learn. We are equipping the child to come up with strategies and some methods where the child is independent, equipped enough to go through the academic process confidently and with good self esteem. The focus of remedial education is on developing the underlying process essential to a child's ability to handle various academic and executive demands. We are not facilitating the child with, you know, a rote learning. We are not telling the child, okay, this is your syllabus and you learn all this stuff and come. Remedial education is a very systematic and scientific approach of teaching. Okay, and the best approaches follow the multisensory approach, where it is visual, auditory, kinesthetic, and tactile. Now, in general, everyone has a different approach of learning. Someone is, a visual learner. Someone is a auditory learner. Someone is a, kinesthetic learner, or a combination of visual and auditory learner. So we learn. Some children learn by, just reading and reading and reading. Some have to actually write to learn. So they fall under kinesthetic learners. So we have to see what type of learning style a child has, and then design a plan for the child to make the complete process very pleasing and motivating for the child. Now let us talk about the accommodations that we have. Okay, so why do we need all these remedial education plans? Because there are certain accommodations that are given to the child in the school. Okay, so the child may be provided with the multiple choice questions. The child may be the writing errors may be ignored. So these are the things that the child will get if the child is attending the remedial education plans. Now we have this is a very crisp IEP that I have created here. Okay, it is, otherwise it is a very lengthy IEP, which is, annual program is made, which is, again, there are three months modules that are created, and it is broken down to everyday level. So, so this is a very crisp IEP. So for reading, what are the areas that we have to cover? It is comprehension, it is reading accuracy, it is reading rate and fluency. Now, for this, let us see what are the traits that a child with SLD will show us. Now we have seen Tare Zameen Par. Okay, the only thing that we remember is, okay, he sees mirror images. Okay, so that is just one area that we have to address to. There are various difficulties that the child with SLD will have. When it comes to comprehension, the child may be a very fluent reader, but not internalizing anything. Okay, he's just reading. He is not making sense of that reading. So we start from the level of, word reading, then a simple sentence, then a complex sentence. So it has to be done very systematically. We just cannot jump into, okay, he's in sixth standard and he is not able to read, let us go into, first chapter and then start from there. No, it's not that way. The child is not able to read. How we have done the assessment, CBA informal assessment, we go to the grade level and we begin. Now, the child may have certain spelling accuracies. Okay, let me state a few examples. The child may do omissions. Okay, the child may have invented words. Okay, the child may find difficulties with homophones. Okay, same sounding words. The child may not be able to differentiate between the same sounding words. So things that come naturally to us, okay, are very difficult for a child with learning disability. Then the written expression may be affected, the grammar, the punctuation. Okay, then we come to math. So math, the child may struggle with the number skills, the number concepts. A simple activity just as counting, the child may not find it that easy. The child may, when the algebra starts, the child may get goofed up with what is A, what is B. The child may, because they have problems. Now we have to keep in mind what are the areas of difficulty. That they have areas of difficulty as the spatial organization. So we have to see, okay, where the child is lacking. The child is lacking a spatial organ. The child bit, when we do regrouping in maths, okay, so we carry over. The child will not know where to put this carryover because he has not developed spatial organization. So we need to see, okay, now this is the area that has to be done. So the autist, we need to be it is a interdisciplinary team. So the autist has to be made aware, okay, now the child is struggling with this area, so that area needs to be worked. So then in maths, when it comes to word problems, because the child has reading problem, the child will definitely not be able to decode the word problem. The child is not able to comprehend what is expected in the problem. Then they'll be, because they are struggling with their memorization, so when it comes to arithmetic facts, they will not be plus and minus, plus and plus, minus and minus. For them it is difficult because they are not able to memorize the rules. So we have to work on those areas, keeping in what the deficit areas are of development of fine and gross and perception level. Okay, so attention, perception, and memory. These three areas we have to keep in mind when we are working with the child on IEP. Now, here are some examples, okay, for how a remediation works. So, this is one of the worksheets that is done, okay. Now, this is called a word web. So, where in the center we have, suppose we put here, let us take an example of animals. So, then the child is asked to fill in the remaining bubbles. So then the child would put, the animals, they can be wild animals, pet animals, they can be farm animals. Then we subdivide. Okay. Now wild animals can be, carnivore or herbivore or no. So this is the word web that helps the child in arranging their thoughts properly. So what happens with SLD? Why are we giving this to the child with SLD? Because they have the ideas, they have the thoughts, but because they lack planning, the executive function, they're not able to organize their thoughts well. So with such, graphic presentations, okay, organizers, we help them organize their thoughts well, organize their ideas well. So graphic organizers help well with a child with learning disabilities. Now when let's take another example, okay, this is a analytical example where the child suppose we take a example of compare and contrast. Now the child is expected to say the compare and contrast different vehicles. So we are giving here a framework for the child to work on. Okay, so vehicles can be, road vehicles, can be water vehicles. So modes of transport we can take. We can take different compare and contrast. We can take, reptiles and amphibians, or we can ask the child to arrange their ideas in an organized way through graphic organizers. Now, another example is of a comprehension paragraph. So, what children with specific learning disability struggle is they read through. Okay, they read through, they may make some sense of the comprehension or the paragraph that they have read, but what is the main idea? What is the theme of the story? Now everything has to be, consolidated. Our learnings have to consolidate it in some ways. So when they are reading through, they just read it as word, a sentence, okay, a paragraph, but the consolidation is not happening simultaneously. So we work with the reading aspect. So here is a small paragraph. Okay, suppose this is a paragraph where a child is a soccer player, he practices every day, and so on. And we ask the child to write what is the main idea of the story here. Okay, and we also ask the child to give the supporting parts for the story. So why do you feel that this is the main idea? So we are trying to reinforce that main idea by the child. Now this is an example of a written expression. How does it look like when the child has difficulties in written expression? Okay, I have learned that there are 5 steps in writing a story. Okay, now here you will notice that writing has become RIGHT because it is a homophone. Now WRITE, the child is not able to understand what right and what right, the difference between right and right is. Okay, so these are the some of the common errors that the child with specific learning disability with manifest. So here, when we go to this part, okay, written expression, then a separate remedial program is designed for the child. Okay, and then it is a very detail that we start with, you know, a simple sound phonics for the child. Okay, sound and letter association, because that is the area that they're struggling with, because it is a language processing disorder. They are not able to process as we do. Okay, so for them it is they read something, they are not able to put it in the right language form, or if they have something in their mind, they're not able to put express it in the right language. So that is the whole process that they are finding difficult. Okay, so this is one of the examples of writing expression difficulties. Okay, and there are some adaptive tools, okay, that are used when we are remediating the child. So if the child is struggling with the proper tripod grip, so there are various pencil grips that are available in the market. So this is just one of them. Okay, this will support the child in writing. So there is no absolutely no harm in, you know, taking support of the available resources that are available to us for, you know, mediating the child. So pencil grip is one of them. The another resources that we can use is, there are a lot of people who use voice recorders. Okay, so in school maybe it is not required, but when the child is entering into the college or into the, no, professional courses, the child will still find difficulties in their learning process. The child can use voice recorders. Okay, so because they're not able to follow what is happening in the class, okay, every word, so they may just record it, go home and listen to it at their convenience. So these are some of the no tools that we can use. Then they are also provided concessions to use calculator. So it's there is no absolute harm in using these adaptive tools, because it is for the benefit of the child. Now this is an example of math remediation. Okay, looking at it, we see it as just some, no, colored circles. So but the child has problem in sequencing, a child with specific learning disability. So when, if the sequencing has not developed, the child will struggle with addition, the child will struggle with subtraction. So how do we go about, you know, teaching the child before and after numbers, or in between numbers? So now we can start with the simple activity of colors and circles. Now we can start with, okay, where is blue circle? Okay, now what is after blue circle? What is before blue circle? Okay, when we are done with the, no, with colors, we can go to numbers. Here we replace the circles with numbers, so the child has certain idea. Okay, now it's the same thing, now it's replaced by numbers. So we have our before and after numbers in place, so we have our addition and subtraction in place. So this is what remediation is. Okay, going to the child's level and making the child understand. Okay, so we are creating a foundation of what the learning is, for the learning. uh, Now let us see what academic accommodations are available as per the PWD Act for the child with specific learning disabilities per se. Now CBSE, SSC, ICSE, all the boards have facilities for the child with specific learning disabilities. They get extra time to complete their papers. Okay. Then they have a scribe facility also. The child who has difficulty with written expression can avail the facility of a writer. The writer can be a grade below, okay, and who will write for the child, okay, in the presence of a special educator. Then there is exemption from the third language. Okay, in the state board they have a three language formula. In the CBSE they have a two language formula. So they can opt for one language, and another they can go for experiential subjects such as bookkeeping, or art and craft, or PE for that matter. Then if they are struggling with their maths, okay, if they are have difficulties in their math, so they can opt for the lower level maths. Okay, in state board they can go in for the seventh grade maths, or in CBSE they can just get away with the maths and take an optional subject, okay, instead of the maths. Now some additional are like they can have a nearest center for examination. Okay, so these are some facilities that are available to the children with specific learning disabilities here. Uh, Now there are some case studies here. So if there are any doubts here, we can clear them before we go to the case studies.
Hello, ma'am.
Yeah, yes,
Hello.
yes.
Yeah, ma'am. Actually, we are going to take the question answer session in the end after Savan sir's session. So
Fine,
I have
fine.
instructed. So is it okay with you if we take it at the end of the session?
Yeah, fine, absolutely, no issues. Yeah,
Yeah. So those who are so those who are having any queries or doubts or questions, just put it in the chat box. We will mention them at the end of the session, ma'am.
fine. So
Yeah, yeah.
we go ahead with the case studies.
Yeah, ma'am. Yeah.
Yeah.
Oh,
Uh,
yeah, ma'am.
yeah.
Okay.
Can I ask two volunteers if someone can volunteer here to no to discuss the case studies, because we will be identifying the disability and also designing a management plan for the cases. So anyone here who can unmute and just volunteer for this? Is there anyone?
I will
Yes,
request.
ma'am.
Yeah, I will request to the audience who are volunteers. As per ma'am's instruction, you can participate in the case studies. Yeah.
Yes, ma'am. I'm Dr. Shivani, ma'am. I would like to. Uh,
Fine. Yeah, thank you, Doctor
yeah.
Shanali. Right? What did you? I
Shivani,
can't.
ma'am.
Shivani. Fine. So we have Dr. Shivani here. Okay, discussing with us the case study. Hello.
Yes.
Yeah. So here is a case. Okay. So this is a girl child, 6 years. Okay, studying in first grade. So what are the presentations? Okay, given to us by the parent, because we are looking from the OPD point of view here. Okay, the parent comes to us and says that the child keeps moving around the house, unable to follow and maintain conversation, bumps into things and people, is unable to learn cycling, talks too much, is very friendly, has no stage anxiety, can come to anyone and talk. I know he's comfortable with everyone around, but gets easily bullied by friends. Okay, the elder brother, can get away with her, or the cousins can get away with her. So she avoids homework completion, she avoids learning, she avoids practicing spellings, she's unable to learn the poems. Then she enjoys doing maths homework, but okay, at the same time. And when it comes to her book, she is not well maintained. She scribbles over the book. The book covers are torn. So this is the presentation given to the parent. So Dr. Shivani, yes. How do we go about
Yes,
dealing
ma'am.
with this one?
We'll see the problem areas first. What she's suffering from, like she has a math difficulty. Otherwise, she's very good at the social things. But she doesn't have any strangers anxiety. Hello,
Yeah.
am I
Continue,
audible?
Shivani. Yes, Shivani.
Uh,
Shivani, 1 minute. Shivani, 1 minute. Bharati, ma'am. Hello, ma'am.
Yeah, yeah. I'll mute myself.
Sorry. Yeah.
I'll mute myself.
No, no,
Yeah.
no, no. Sorry to interrupt you. I'll just want to instruct all the audience, apart from Dr. Shivani, who is asking the question, no, or who is reading the case study. All the participants, please mute themselves. Other than Shivani and ma'am, no one will be
मेरा
unmuted.
पर्स
Okay,
दे दो
so
मेरा
that
पर्स पलंग
voice
पे
will
ही
be.
है वो दे दो
Hello.
अरे वो
Yes, ma'am. Continue.
Yeah,
Shivani, you
Shivani,
can
Dr. Shivani, you
continue.
can continue with your assessment.
Uh,
Dr. Shivani, you
okay,
can
ma'am.
continue. Yeah.
Okay, thank you, ma'am. So she is like she is not unable she is not able to follow the conversation.
Hmm.
People easily bully her.
Yeah.
So, but yeah, but she doesn't have fear like stranger anxiety. She doesn't have. Um, then she avoids school homework, but she like reading and learning spellings, and doesn't like and
No,
enjoys
no,
doing
she
math
does.
work.
I'll just stop you. She doesn't like learning spelling. She likes doing only maths.
Yeah, she
Reading
likes
and spellings, she avoids.
yeah,
Yeah.
and she is not in keeping her books well also. Pages are either scribbled or overtorn.
Yeah.
Yes. So then what will be the next step, ma'am? What should we do if we are like,
Yeah. So
ma'am?
I hear what is your learning that with the presentation that we just covered? So what is your assumptions? Let us say.
Okay. She is in normal school, grade one,
Yeah,
CBSE
CBSE
board.
board. Yeah.
Okay. She is like she
Let
is
us let us see the what advice you would give the parents, or what reference you will make.
ma'am. Uh,
Yeah.
Special learning will be there for special learning disabilities because she doesn't like spellings, unable to
Yeah.
memorize the poems.
Yeah.
I'll ask them to go for that.
Hmm.
Could be dyslexia or something like that to just to rule out that.
Mm-hmm.
Otherwise, she talks excessively. So ASD is uh, she talks excessively. So ASD is ruled out because she
Mm-hmm.
doesn't have the stranger anxiety also.
Mm-hmm.
Could be ADHD hyperactivity, but we can't. We have to go into details about the ADHD.
Mm-hmm.
Yes, ma'am.
Okay, so that would be your observation. Okay, any reference that you would like to make for the child?
To the clinical
Any
psychologist.
other therapeutic intervention that the child will need?
No, ma'am. I
No?
don't know, ma'am.
Okay, so okay, so now anyone else who wants to try on this case, or should I no, discuss and close? Okay, so now let me only discuss it and close it. Okay, now we have to see for some of the red flags that we see. Okay,
Okay.
because at 6 we are not going to diagnose the child. Okay, the diagnosis will happen
Okay.
only when the child is 8 years and above.
Hello.
Formal
Hello.
yes, yes,
Ma'am,
yeah,
sorry to interrupt you again. There is
yeah.
lot of disturbance, noise disturbance. So I just want to instruct all the participants kindly mute themselves, and only those who want to be volunteer now, please drop your name or write your name in the chat box. I will unmute only that participant. Otherwise, too much noise disturbance is there. हाँ, त्यांना unmute कर. Hello,
I
ma'am. You
yeah,
yeah, ma'am.
I'll
You can
continue.
continue. Yes,
I'll
ma'am. Sorry,
continue.
sorry.
Yeah,
Yes,
yeah.
ma'am. You can. Yeah.
Okay. So now we will see for some red flags, because at 6 we are not going to diagnose the child as such for formal assessment. So we will just see certain observation. We'll have some certain observations. Okay. Now the child is moving around on the go as per the parents. So we have to see, okay, the child may have certain ADHD traits. Okay. Or the thing is, next thing is that the child is bumping into things and people, is unable to learn cycling. Here the motor developments are affected. So we need to have a referral for the OT here, because the child is not able to coordinate well. Okay, then the child is talking excessively, is over friendly, then again, okay, it may fall into ADHD or SLD here. Now is easily bullied by friends, siblings and cousin. Okay, so they are gullible. That is a feature of being on the SLD. So we have to keep certain things into mind. We are not diagnosing the child, we're not giving a proper diagnosis, we are just seeing what are the red flags and what intervention plan that we will advise to the parent. Now the child is enjoying maths homework, but the child is not enjoying reading or writing. So we have to see, okay, now the child is enjoying maths. The child, it's not that the child has any aversions toward academics. Okay, maybe the child is struggling with the reading part. So maybe there is an SLT, okay, which we have to look into. Books are not well maintained. Maybe there are some behavior concerns here. So we will have to make certain observation and referrals here. The child will have to attend occupational therapy. We can advise the parents that the child needs an occupational therapy. That if the child has learning here, so we will refer the child to for a maybe developmental pediatrician. Okay, so to for further evaluation. Okay, the developmental pediatrician would do the needful here. So this would be the analysis for this case. Now moving on to the next case. Uh, Again, I would like someone to help me out, discussing and sorting out this case. Anyone here? Yes. Do I go ahead with discussing the second case then? Okay. So now here, yeah. So the case, the presentation given to us is the child. It's a boy falling into the age group of pre-teens, and is in sixth grade and is attending a CBSE school. The child is not regular to school, misses school by giving lame excuses either of health or sleep, and the parents have been receiving complaints from the school about his discipline and his behavior. The child avoids completing his schoolwork, is not interested in writing, is able to read but makes a lot of mistakes. And recently he has failed in English and social science paper, and he is not very pally with his friends. Okay, he has a lot of conflicts with his friends in the society, and those conflicts reach home, and which are then the uh, elders have to get into sorting out those issues. The child is not interested in attending any curricular activities. Okay, and when it is informed that when he was sent for karate or abacus class, it had to be stopped because he started lying in order to avoid the classes. Okay, so giving some excuses that the class is postponed or the class is cancelled or the sir is not well, something like this. And the parents also inform us that the child needs to be reminded for the simple stuff like brushing and taking care of himself or bathing, or there's no study skills at all developed. So in this case, what do we do? How do we go about making certain assessment and referrals here? Anyone here who wants to share their view on this? Okay. So I continue. Okay. Now we see here that the child is not regular to school, is missing the school. Okay. So we see that the child is not self
Ma'am,
motivated. Yeah. Yes. Yes. Continue. Yeah.
ma'am,
I.
yeah, ma'am.
Yes.
Myself, Dr. Sohail, I want to ask the question.
Yeah, yeah, please go ahead.
Yeah, yeah. As you can see in this case, ma'am,
Yes, yes, doctor.
as you can see in this case study,
Mm,
the child is not ready for going to school or any other. He is not able to attend the classes. He is giving an excuse again and again to the parents.
mm-hmm.
So, is there any issues with the child in the school and some misbehaving with the child or something? So, parents'
Yes,
issues are very much important in such conditions.
yes,
They should,
absolutely.
yeah, they should inquire about how the schooling is going on.
Uh,
So, they should visit and consult the child is very prior in such conditions.
yes, yes. Good observation that you have made here. Anything else? Hello? Yeah, doctor. Anything else that you would like to mention here about the other areas, difficulties that the child is facing?
No, ma'am.
Yeah, yeah, that's a good observation. Okay, now the children with specific learning disabilities are always at the receiving end. Okay, they are at risk of getting bullied in the school, okay, by peers. So we need to find out. Okay, so we need to see why the child is not interested in attending the school, why is the child giving excuses for being away from the school. So we here the counselor's role comes into. Okay, so maybe the child is sent to the counselor, or the child maybe the child school counselor can help us into this. Okay, so getting the feedback, okay, collecting the feedback from the parents. Okay, so next is the child is making certain spelling mistakes. So we have to see. Okay, we will in the case history taking we will ask, okay, the parents, okay, now are there any specific type of mistake that the child is making. Okay, the parent may say, okay, he makes his own spellings. Okay, so when we ask him, okay, orally he is able to say, but when we tell him to write, he is writing some different spelling. So then we have to note it down. Okay, or the child has making reversals, the child is not able to write B and D properly. Okay, so reversals are happening here, or there is certain additions. Okay, now if we tell the child to write bag, so the child is writing, putting some extra words there. BAG is there, but along with it there are some additions that are happening to the word. So we need to ask all these details when we are taking the case history, what type of spelling mistake the child is making, because it is it at gross level or it is a acceptable level. Now child has failed in English and social science. Okay, so this is something that we need to look into carefully. Now why the child has failed only into English and social science? Okay, so because it is a theory paper and it involves English, involves grammar skills. Okay, then social science are papers where we have to write down a lot, memorize a lot. Okay, science and maths we have all lot little of writing, or math science we have more of, answer in one words, answer in simple sentences, but SSC requires a lot of writing. So we have to look into all the specifications when we are taking the case history. Then conflicts with friends and society. So there are certain emotional issues, or we have to attend to all the areas of the child. Why is the child behaving in a particular way? Why is the child not interested in going to school? Is a fight happening with a particular friend only, or is it with everyone? Then here, when the child is not attending extracurricular activities, is the child at low at motivation level? Is the self-esteem getting affected somewhere because of something? So these are the things that we have to look into. Then we need to make referrals. Okay. Then here the referrals would be, in this case it would be for a counselor. Okay, to get into the assessment part. Then it would be for because the child is weak in his academic subjects, then maybe the parents need to uh, get into a meet a developmental pediatrician and see whether, or they can meet a psychologist, okay,
It's
and
not
get this
audible. You're
assessment.
not able to hear.
Not audible? Is it okay now? Yeah. So in this case, we are going to refer it to the counselor. Okay. Then we are going to take help of the psychologist. Okay, or the developmental pediatrician. Because here we don't find any issues with the fine and gross motors because the parents are not presented it to us. Then we don't find any issues with the speech, so we don't need to refer it to the speech therapist. Now we go to the third case. Uh, I'm reading the case. In the meanwhile, if someone would like to discuss and uh, analyze the case, please come up. Okay. Now this is the third case. It's a girl child studying in senior KG in a CBSE school. Okay. Uh, the presentations that we have is the child is over enthusiastic, okay, and is very interested in all the activities that are happening in the school, likes going to school, but is not able to follow the complex instructions. The parents tell us कि जब मैम उसको बोलती है कि बैठ जाओ तो वो बैठ जाती है, लेकिन जब मैम उसको बोलती है कि बैठ जाओ और अपने बैग से मैथ्स की बुक निकालो, नोटबुक निकालो, then she is lost. Okay, then she just sits down. Okay, there is no response to that instruction. Can follow only simple commands. Okay, likes reading, but there are a lot of mistakes, especially with letters and numbers. Now next is that the child is able to read simple sentences but is not able to understand the meaning, and the teacher or the parent has to translate it into the mother tongue for the child. Okay, the child is stubborn. Okay, okay, बहुत जिद्दी है, जो चाहिए तो चाहिए. Okay, and but at the same time the child likes to be pampered. Okay, the child is fussy about it, is very particular of about having only, uh, doesn't eat roti and sabzi, likes only rice and rice preparations. So in this case, what would be our observation? So anyone who would like to take up this case and discuss? Okay, so because we have the time constraint, let me go ahead and discussing this case. Okay, now what are the stuff that we need to look into here? Now the child is very enthusiastic, okay, very self motivated, but the child is struggling to follow simple complex commands. Simple follow command the child is able to follow, complex the child is not able to follow. So somewhere the auditory processing is affected. The child likes reading and writing but makes a lot of mistakes. So somewhere the cognitive skills are not developed properly. Now now in this next point we have to be very careful. The as per the parent, the mother tongue has to be used as a medium of communication. So maybe is there a language barrier? So there are sometimes, presentations which have language barriers. Okay, or maybe it is a first generation learner. Okay, so we have to get all this through our case history, whether it is a first generation learner, so the presentation will be totally different. Then we have to make the assessment and the reference according to that. Okay, the child is very stubborn but likes to be pampered. So are there any parenting styles that the family has? Maybe the child parents are very overprotective or over controlling the child, is fussy about food. So maybe that is attention seeking behavior of the child. So everything has to be considered when we are dealing. Accordingly, the reference would be made. So in this case, the we have to see whether what type of mistake the child is making. If the letters are happening, the child is not able to understand the numbers completely, or the child has mistakes like with, at this age the common mistake the child would make is skipping the numbers. Okay, then the memory is at play, or making certain errors in writing the letter formations. So we have to this age is at the red flag. So we will not send the child for diagnosis, will send the child for remediation. Okay, and see whether the child is at risk or developing any specific learning disability. Now this is the last case. Okay, so here the child is 2 years, a boy. Okay, is happy but has suddenly stopped responding to his name, does not point to things like the other children do, says only mama and makes certain sounds, walks and stands independently. But when it comes to play, the child likes to play only with blocks and is also engrossed in arranging the box in a certain pattern, and is very attracted towards moving fans. Okay, and when the fan is switched off, gets into crying and screaming mode. So in this case, we have to see what are the early symptoms of autism. The child is 2 years, we cannot say that the child is autistic here. Okay, so then we, under when we cannot label the child, we will put it as a global developmental delay category. Okay. So here the child is not responding to his game, and in the, as we see in autism, okay, there is a normal development till the age of 1, and after 1 there's a regression that happens. The learned skills are suddenly lost. Okay. So we have to see, okay, the child was fine till in the first year. The second year, the child has suddenly stopped responding to his name. So we have to be little careful about this. The child, like other children, did not develop pointing. So this is again a red flag for autism. So the child can stand and walk independently. That means the fine motor and gross motors are developing properly, but we have to still look into and be cautious about it. And when it comes to play, the child is showing a typical development, a child with autism. So arranging the blocks in a linear pattern, and is obsessed about moving fans. So these are the things, and we need to alert the parent. Okay, now these are the things. Now when we are informing the parent, we have to be very careful that we don't disclose our diagnosis to the parent. We have to either take the help of a counselor, or maybe we can present it with empathy. Okay, so here in this case, we would put the child at risk, okay, on the global developmental delay. Okay, and accordingly, we'll make the referrals for the speech therapy because the child is not picked up,
And we are not audible.
Okay, okay. Is it better now? So we will make the referrals for the speech therapy because the child has not picked up language. Okay, and then here, because the child is not playing with the play stuff properly, then the child needs a play therapy. Okay, this is again a new play a therapy which engages the child into the appropriate strategies of play and helps the child in their overall development. uh, so, and an occupational therapist that you can make a referral because the child has certain sensory issues, so the child is admiring the fan. So these are the observations that we will make and inform the parent accordingly, yes, in this case. So with this, I'm done with my presentation, and I would like to close. Say, okay, now when we talk about our education system and
Again, it's not audible.
oh, okay, now is it okay?
Yeah.
Yeah. So now if we try to judge a fish, by its ability to climb a tree. So I would like to change the phrase. We are not making a fool of the fish. We are making a fool of ourselves here. So, so when it comes to children with special needs or children with specific learning disabilities, we have to be very careful and cautious about how we are behaving, how we are interacting with the parent and the child here. So we have to redesign our learning, our teaching methods according to the child. So we take the example of, we cannot make it a fish centric, we have to make it a child centric. Our system has to be child centric when we are dealing with SLD. Yeah, that's it. Thank you so much for this opportunity. Now we wait for the questions after we are done with the complete session. This is what I understand, right?
Yes, ma'am. Yes, ma'am.
Yeah, yeah.
Many of the audience are eager to ask the question, so we will be taking in the end, that is question answer session. So So
Fine.
we have requested. Okay.
Fine. Fine. Fine.
Yeah,
Yeah.
yeah.
Thank you so
Okay.
much, ma'am. Yeah.
Yeah, yeah. Thank you so much, ma'am. I would like to say thank you to Dr. Bharti Kapoor, ma'am, for such an enlightening session and guiding all the audiences and viewers about the different aspects of the learning disabilities, how to diagnose them earlier, what are the ways to assess them, and what are the different ways of intervening these children delicately and in a special manner, along with the help of the case studies. Thank you so much, ma'am, for such an enlightening session. And information provided by you will be truly beneficial for all the viewers and the students and the staff. Okay. So now I would like to discuss something about the homeopathy. Okay, as all we have heard about, or as we all have known about what are the learning disabilities and how to tackle them. Now, how to deal this problem with the homeopathy. So what is homeopathically basically? So homeopathy is that branch of science which cures the various health problems very gently, permanently, and treats any of the health problem at its root cause. So when we are dealing such health problems like learning disabilities along with the homeopathic intervention with the remedial education, the result which we are founding will be truly wonderful and very very effective to change the quality of the life of the child in a very positive way. So to guide about this homeopathic approach, homeopathic aspect in dealing with the cases of learning disabilities, we have got with us, we would like to welcome our next distinguished speaker, Dr. Vinod Sawant sir. Sir has done MD homeopathy from our own institute, Yerla Homeopathic Medical College. He had completed his postgraduate training from Dr. M.L. Dhavle Memorial Trust, Palghar. Sir is working as an associate professor in the Department of Homeopathic Materia Medica at Yerla Homeopathic Medical College. Sir is also working as PG guide and PhD guide appointed by MUHS Nasik. Sir has got 24 years of clinical experience in the field of homeopathy in treating various pediatric cases successfully. So, without wasting much more time, I would like to request Dr. Vinod Sawant sir to start with the session. So, I would like to hand over the mic to Sawant sir. Yes, sir. Hello, sir. Is
Hello,
it
good
all?
afternoon.
Yeah, sir.
Good afternoon to everybody. Can we have the slides?
Hello, sir.
Yeah,
Is it
yeah, this I
audible?
can
Yes, sir. Yes. Sir.
desktop on the desktop. Yeah. Okay. After a elaborative lecture by Mrs. Bharti Kapoor, my task has become easy. So I will directly focus on the therapeutic part. Yeah, unmuted. So directly focus on the therapeutic part of homeopathy. Okay, education in the civilized society is a process where the learning is facilitated by yeah, not visible.
Hello, sir. Hello. Hello, sir. Sir, unmute. Hello. हाँ, sir.
Slides are visible.
Uh, just a minute. Not visible, sir. It slides are not visible. Even
Now,
voice is also breaking. Yeah, yeah. Now it's started with screen sharing. It's visible.
uh,
Yes, sir.
how to go ahead? Okay, the purpose of education is developing the innate capacity of intelligence, cognitive development, the emotional refinement, to the best of its individual capacity, the motivation, self-regulation, the concept of self, so as to live a productive, happy, and a very creative life in future and in the current childhood also. Okay. As far as homeopathy is concerned, when we are dealing with these learning disorders, learning disabilities, and the conditions which are discussed by Madam Kapoor, is ASD and ADHD. So now all the major interventions as far as the treatment of this part is concerned is basically the remedial education or the physiotherapy, occupational therapy, speech therapy, and special therapies which are required. There is very limited scope for the pharmacology as far as the modern medicine is concerned. Now, homeopathy, the basic focus on the treatment is the person who is diseased and not the disease. So the whole focus is on the personality understanding and understanding the individualized the remedy which is for changes from person to person. Like in the other treatment modalities, which are or ancillary treatment modalities, which are non-pharmacological treatment modalities, the base of the treatment is based on the assessment of the condition in details. Whereas in homeopathy, we use it for the diagnostic purpose and for the evaluation purpose. Now, as far as the child is concerned, the child is in the developing phase. The mind of the child is not completely formulated. The child is in the formative years. So keeping that in mind, I will proceed ahead in understanding the homeopathic therapeutics. So first we'll go to understanding the personality in homeopathy. Now, the person, the essential evolutionary totality, is designed by Dr. M.L. Dhawale, which is an integrated approach in homeopathy. Like stalwarts like Dr. Kent, Dr. Boger, Dr. Bonninghausen, they have developed various insights in homeopathy. And after integrating, we come to the idea of essential evolutionary totality. So, as we discussed, we are focusing on the man in disease and not the disease in man. Man in disease. Now, as a person as a child is born, it comes with some kind of a genetic heritage. Now, genetic heritage, there is a mental traits which are inborn in the child, which can be very well seen in an infant also. There's an infant mental trait inventory which is there available. Then we have some basic bodily features of a person, and we know the color of the skin, the features, and the height, and the type of the body, type of the skin, the type of the hair. All these details are available, and there are some fundamental disease potential which is there in the genetics, which we called as fundamental miasm. Now, all this we call as a predisposition, which we do not have any control over. This comes to us by nature, and we have very limited role. We definitely have some role in pregnancy and the management of the antenatal care in terms of nutrition, in terms of the mental health. Those can definitely be done, and but larger part of it is by the nature. What kind of genetic material a person is going to get is not in our control, so we call it predisposition. The disposition in child is a very changing phenomenon, because by, say, for all practical purposes and all the legal systems, by 18 years of age we consider that the person has become to a sol the traits have solidified, and now henceforth there are not going to be a major changes in the personality. Now, this aspect of the person is called as disposition traits. This person is going to carry throughout life. So as far as homeopathy is concerned, what is the mental aspect of disposition? So disposition is affect, which is the emotions and mood. Cognition, which is intellect, which is various intelligences, various intellectual capacities, the ability to discriminate, ability to abstract, and the behavior. Now, mind, we have two major components to mind. One is our survival level of the mind, which is very the limbic as part of the brain, which is it is derived by the fear and the protection and the hunger. It is motivated by these aspects, and where many survival protection is the major concern there. Then we human beings have a neocortex, which is a higher functions, where the human being is the only animal which can go in the future and get back into past, can come with the ideas and the various relationships and forms, which is purely human. And here is what the idea of education comes. Now, all the animals, they live with the primitive instinct. They cannot be, certain aspects can be taught to dogs and certain animals, but major part of that is instinctive. Now, human being during the civilization, they have understood that the neocortical ability can be trained and taken to the higher level so that the person can enjoy a more joyful life and can have a very fulfilled and accomplished life. Now, here in the disposition, we want to know that qualitative aspect of effect, and that qualitative the detailed aspects of cognition and the behavioral pattern, which we'll discuss further down. Now, as far as the body part of the disposition is concerned, we are talking about a constitution, which the larger part of that we have got by our heritage from the parents, where we talk of more the body type, the type of the hair, the color of the skin. For example, Mathematics very nicely explains about the type of the hair, like blonde hair, like curly hair, like thick hair, like the skin, the body hair is more in quantity, like the color of the hair, the features, the person is the skin is a delicate skin, the type of the mole distribution, the such finer aspects of the constitution, which we call as the physical makeup of the person, which is again very individualized. Then the more the functional part of the body, that is like in modern science we call it physiology. Here the homeopathic functional part is physical generals, where the individualistic cravings, aversion, thirst, thermal state, and the sweat and the menses and the discharges, these aspects are considered in the disposition. Now, what is the great about this disposition? The disposition by 16 to 18 years of age more or less gets crystallized, and henceforth is not going to change in a major way. And this can be called as a normality of that person. And as we understand that these learning disorders which are developing can affect development of this disposition at the mental level also, and we do not want these learning disabilities to interfere with the full potential of the mental affect and the cognition and the behavior of the person so that to enjoy the fullest experience of the life. So a lot of this gets mixed with the presentation of these disabilities also. So that has to be kept in mind while understanding the disposition. So disposition we can consider as the normality of a person. Can we have this? We can't do this. Okay. Now, in predisposition, we have certain traits which are genetically programmed that person to get a disease pattern. Now, that is a condition where the miasm has worked enough on the disposition. The miasm, which has a fundamental aspect, which comes from by birth and the life and living. Now, disposition development has impact of society, education, the parenting, all these things, the food, the pattern of food, the weather conditions, all that develops the disposition. Now, once the miasm, that is disease capacity, disease making capacity in the person starts working on the disposition, and due to certain maintaining causes or certain exciting causes, the disposition can break down into diathesis, and the diathesis, the person, you will see all those predisposing conditions and the disease potential which the person has acquired after throughout the life and living, the person will break down into diathesis. Now, this learning disabilities, we see in a very early childhood, we start seeing the manifestation of that in the early formative years. So automatically, the impact of the fundamental miasm is very strong. The fundamental miasm. So now in homeopathy, we are going to focus on the other diathesis aspects of the person, that is the characteristic sensations, the pathological generals, which will help us to pinpoint the remedial aspects of that person. Now, as for the disease part is concerned, where you have a clear-cut diagnostic mental conditions, where with the diathesis has now been more worked upon by the miasm, and the diathesis and broken down into disease. Now, diathesis, we can call it little pre-morbid condition, and disease as a complete morbid condition where the manifestation starts from general to local. Like as Hahnemann said, first general disturbance and to the local disturbance. So affective cognitive behavioral disorders, as mentioned by DSM-4, and the medical conditions from all head to toe in location, sensation, modalities, and concomitant form. Now, once we have this model in front of us, so the data which has been with the knowledge which has been discussed since morning by Madam Bharti Kapoor, that thing is it our problem definition. Now we want to find our remedy. Now you see in Materia Medica, all this dispositional diathesis and disease data is written in a very mixed pattern. So many times a person may be in a dispositional state and has not gone to the diathesis or disease state, and yet you come across a lot of disease conditions written. So if you are very clear about the diagnosis of various conditions, so you can give a very clear, you can focus very clearly on the dispositional quality of the person. Now, people like great doctors like Dr. Sigmund Freud, Dr. Carl Jung, then Erik Erikson has done very pioneer work in the understanding of the psyche of the child. Now you see the child in its early developmental phase is in the very early stage, in the first year of life. Child is a part of mother and child unit, where the main focused person is mother, and the nutrition and the breastfeeding is the main focus. Now, till 2 years of age, a child is quite egocentric. Egocentric means the child is self-centered. Can you mute, because there is some disturbance in the. So, child is egocentric. Now, while understanding the remedy aspect, suppose we take that as a rubric selfishness, then we have to discount for the normal development of that child till 2 years. As the child grows beyond 2 years of age, the child starts behaving little, the selfishness starts going down, and the child unselfish behavior starts expressing. Now, what is the concept behind starting education at a particular age? So Madame Montessori was a lady who has done a lot of work when certain examples were there in front of her. If the squirrel is not given nuts to break at a critical age, then after that, that squirrel cannot break those nuts. Similarly, if a child is not given exposure to certain kind of a learning experience and sensitization, the child will find it difficult to later on pick up that ability. So according to that, the whole education policy all over the world is programmed. Now today we go by the phenomenological aspect of education, where you go by topic and experience based education and not the subject based education, where the inter-subject interaction is very important. So as we go ahead, we have to know at what age, what kind of educational milestone is going to come. And in understanding the disposition of the child, we are going to focus in the understanding of the cognition of the person in that direction. Okay, so there is a concept of multiple intelligence where Dr. Gardner has made major work in that, and to understand the traits of the person, which are, they are overlapping. Some of them are mental, and few of them are have a physical aspect to it. So now when it comes to the understanding of the cognition of the child in the disposition as a dispositional quality, what is the theoretical background, or what is the plan which you have in your mind, so that you can go ahead and asking. Otherwise you will end up asking some superficial questions related to the cognition, because all other aspect of cognition the school is going to understand the detail, the finer aspects of that. And so to have some background guidelines, this is a very good model which I found in my practice and in day-to-day activities, and that has helped us taking going towards the remedy easily. So the musical aspect, the musical intelligence, where the child is generally has more understanding of the various pitch with a musical knowledge, like understanding the music and the impact of the music also, like rhythm, pitch, meter, the melody understanding is little more. Now as far as the the education pattern which is there since the British time in India, the main focus is on the logico-mathematical intelligence, where the ability to understand science and mathematics was the main focus. The people used to understand as the child who is good at mathematics and science is an intelligent child. Now, as and when the research underwent, we have understood that these are the various aspects where you can focus, and you have to go into details into, so as to get the individualistic aspects of the personality. Okay. Now, visual spatial intelligence. Here is the ability to understand the ability to perceive the phenomenon in three-dimensional aspect, ability to, like, the DNA was understood by the scientist in its on the two-dimensional aspects. It took their visuospatial intelligence to understand the three-dimensional, the helix of the DNA pattern. So the three-dimensional understanding, certain children show that in very high skills, and you can in a very refined way. Now at the remedy it's concerned, certain kingdoms like bird kingdom, insect kingdom, so the birds make nest, the insect makes like apis, like the honeybee makes like honeycomb, and these aspects as a doctrine of signature are seen in the children belonging to these kingdoms. So this has a very high importance. Now it comes in the dispositional aspect, in the cognition, but going into the details of this is going to take you straight away to the remedy. Now I have come across two children where the formica rufa was the remedy, and this special intelligence was the first key to enter into the remedial aspect. The linguistic aspects is the command or the language, the ability to learn and the language and the words faster, is ability to express in the language better. So linguistic verb. Now it is said that in the early formative years, the children can learn multiple languages, and a lot of things we see, like in the school education, the child by the time goes to the school already has exposed to the mother tongue, and therefore by that time he doesn't know the written words and doesn't know how to recognize the alphabets. Still the child can speak language. So language is a primarily phenomena which the more what you hear, you can produce it better. You can produce it better. Now here if the person is having problem with the language as a disability, as a learning disability, this particular aspect will not help us to understand the disposition. But suppose there's a problem in other areas, we can definitely use this as a very interesting area where the dispositional quality can be understood. The remedies belonging to the snake kingdom, the remedies which are conditions like substances which are like drugs, like cannabis indica, like opium, and like nux moschata, where with the drug, like influence of drug kind of, you will see that a lot of animated behavior, uses of language, very elaborative uses of language, and the talkativeness which is seen, which can, we can get a hint of the remedy from this particular intelligence. Now, logico-mathematical intelligence, everybody knows for so many years, in the last 50 years, whole focus of the education was on the logico-mathematical intelligence. Now, as far as the learning disabilities are concerned, as was discussed by the previous speaker in the modern in the today's morning session, the math as a problem in the reasoning, in the understanding as a skill, you will find it difficult to understand the dispositional aspect. Then it will, then we will not be able to use this. But remedies like silicia, remedies like nux vomica, lycopodium, in the practice we have seen the logical mathematical ability is higher, and the remedies like calciricab, barytacab, and have little delayed or a poor ability in this intelligence. Body kinesthetic intelligence, or also called as physical intelligence, where the person's ability to bodily movements, like like ability to, this child will pick up like cycle, swimming, will be little early. So the movement sense, the dance. Now, can you develop this intelligence? Now we are talking about some inborn skills. Now, when we are talking about this intelligence modalities, we are talking about the inborn skills. Now, the gardener, when he was asked, can you develop this? Yes, you can develop this to a very nice level, but the inborn capacity qualifies that person having that dispositional quality. So certain people, understanding the dance, the understanding, the learning to ride a bicycle, swimming, is like a child's play, like we are discussing about, but it's like they learn it very fast. Now, at the remedy aspect is concerned, we know the remedies from the cat family, like lacfelinum, like people, the remedies from the snake family, remedies from the plant kingdom, from the creeper family, have shown to have this kind of intelligence in a very refined level. And we can very well understand the doctrine of signature, that the snake and the cat family, in the cat family, the positional sense is very high, and the kind of speed and the coordination which is required. And if you see the creeper going on the tree, like that, the whole that rhythmic movement with the creeper undergoes, and the snake remedies. So this aspect, and we find the body kinesthetic aspects can be a problem in the remedies like agaricus, like remedies like apis. There's a awkward movements, and which can help us towards understanding these remedies, and a clue for the better understanding of the remedy. Now, interpersonal intelligence or the social skills. The social skills, we see certain remedies are very nicely connect to others. They can understand, they can empathize better, they can understand somebody's mood, feelings very easily. That is called as interpersonal intelligence. Our remedies like phosphorus, causticum, cocculus have been seen to have very higher level of this intelligence. Phosphorus can connect to others very nicely, can understand others' mood almost intuitively. Caustic can empathize with others and in a better way, in a more meaningful way. These like cocculus have that kind of feeling for others' pain, and they can spend nights taking care of the So this kind of interpersonal, now this is not about extroverted personality. Here it is ability to connect and intuit and understanding the verbal as well as non-verbal language of the other person, and feel it, this thing. These people will be able to communicate meaningfully with others, and make a better and deep bonds with the others. And we have a lot of such remedies, and we have remedies which lack such ability, like natrium, you find is very difficult to connect, though they can understand, but they cannot communicate in a better way. Certain remedies are not that refined to have this kind of abilities, like remedies from the calcarea group, from the Baraita family, from the very primitive animals like bufo, do not have such kind of abilities so nicely developed. Now this ability to understand the mood and the feelings at so finer level is a neocortical phenomenon which human beings have got, and that makes a human, makes their human experience very refined. And when we do not have such experience refined to that extent, we have remedies, simillimum, coming from primitive members of the animal kingdom. Now, intrapersonal relationship is ability to connect to self. The remedies like nitramure, remedies like silicia, carcinosin, these remedies have very strong, um, 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 this kind of intelligence is seen in a very higher level. So the person can connect to themselves very nicely. There are remedies like calcare floor, fluorine. They find it very difficult to connect to cells. Now, if this connection can sometimes, if in poor interpersonal intelligence and poor social skills, the person may be very reserved and very introvert kind of person also. But and the second half of the life, these people really make good, because they can make more meaningful connection with the self. And when um, the more meaning aspect of the meaningful life of the aspect starts, they can connect to the life in a better way. So that we have remedies which are like silicia, natramure, carcinosin. These are the remedies which show this kind of intelligence very strongly. Now, cognition. Also, cognition is what? Is it a rational mind? The rational mind mainly considers the cognitive phenomenon like perception, like formulation of ideas, thoughts, concepts, systems, memory, the discrimination, abstraction, the action based. So you have to understand these aspects of cognition appropriate to age. Now, the main materia medica is mainly made in the main provers were the adults. Now, how to come to the cognition of a child when from the materia medica? So the allied subjects like psychology and the developmental psychology and the works of Freud and Carl Jung and Erik Erikson has really given us insight. If this is the kind of the adult is showing in the symptoms in the proving or in the drug pictures, what is likely the child as a, this person in the child, in the formative years, the person is likely to be. So, but then you have to give a due discount to the level, like say till 5 to 6 years of age, abstraction for the child is very difficult. So when you ask a 4 years of child that where do you live, his likely answer can be I live at my home. You know, and when you're asking such questions, you are actually asking in which area in that town or that village his home is. So that abstraction has not developed, so you do not expect that kind of abstraction at that level. Now, discrimination, um, um, the like perceptive, the perception aspect we have discussed in morning with the conditions like reading disability, like understanding dyslexia. There can be understanding the letters, and the reading skills can be very much into like perception disorders may be there. And in such situations you have to discount, because that we are dealing with as a problem. But otherwise the perception, you have a fast learners, like the syllabus when it is planned in the school national school curriculum, it is it is kept in the mind the average children milestones at that particular age. A particular child can be above average and a child maybe other child will be below average in a particular intelligence group, maybe good at some other intelligence modality. So you have to give due discount, and the sensitizing age as a particular critical age for that particular ability, if it has come, then only you can get that particular cognition. Because if you try to understand that, suppose a child is, you want to teach words, and if you want to start making that um, therefore there are a lot of, in the developed countries, the age to admission for the school has increased, because if before that you start doing that, then the child will struggle to get that ability, and some child will be little precautious. So we have to understand, and then this precautiousness in the cognitive functions take us to certain remedies like carcinosin, and that itself can, that precautiousness can help us understand the miasm aspect also. So the whole point which I want to make here is that the critical age of developing this cognitive milestone has to be understood while considering the case taking. Now I have just tried to understand some basic emotions like love, joy, surprise, anger, sadness, fear, all of the basic expressions, and how these expressions can be seen in children in terms of, like, now the basic expression of love can express in reality as affection, caring, sentimentality, infatuation, compassion. Then joy as cheerfulness, pride, optimism, the hope, the amusement, and this kind of joy can tell us about the miasm of tubercular miasm. Then miasm part will come again later. Then surprise, then anger, the 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 expression of anger, like jealousy is also an expression of anger, and the disgust is also a very subtle expression of anger. And different remedies will express anger in these different levels, all are different uh, qualitative expressions, like irritability of the nux mamica, the disgust of the like remedies like sepia and lac caninum, and the jealousy of lot of animal remedies like apis and most of the animal remedies like that. The sadness we have sadness, then even a guilt is an expression of sadness, even the hurt is an expression of sadness. And whether a person is feeling hurt, a person is feeling sad, and the remedies will change. Suppose after reprimanded, a child feels embarrassed, child feels hurt, a child feels insulted, the remedial range will be from causticum to ignatia to staphysagria. The range will change, and the basic emotion is sadness. Now the fear, various expressions of fear, we very nicely see in the families like plant family like Solanaceae. This fear as a basic phenomenon is a survival instinctive limbic um, um, emotion, where the survival aspect, the person is the fear protects the person, but this as a protective mechanism over a period of time, if it overwhelms the person, even in a non-threatening situation, will be in a fright and flight motion. And the various expressions from fear to fright to nervousness as a at a very lighter level, to the extent of hysteria, uh, panic and phobias may express, and almost going into the anxiety disorders. Now, as far as the homeopathic part of mind is concerned, the emotional side we consider the most, and that too in the causative or aggravating and ameliorating modalities. Then the emotional state, then the some spontaneous behavior, and then the symptoms of intellect. Now, okay. Now here I have basically tried to understand one second, the miasmatic aspect. Okay, so miasmatic aspect, there is a very in the Indian yogic text, there is a basic uh, qualities of the mind are classified into sattva, raja, and tama. Sattvic, rajasic, and tamasic. Now, if you consider our miasmatic understanding of that, the rajas comes in sora and tubercular miasm, and tamas comes in psychotic and syphilitic aspects. Like sattva talks of goodness, calmness, and the harmonious way, where a person during the educational phenomenon, we want the child to experience these major aspects in life. Now, the child which is more passionate, activity based, movement based, when the movement activity and the passion is it at the lighter level, and the sora is dominant, and when this passion, the activity, the hope, and the movement is too much that exhausts the person, or the person doesn't have the capacity to take that activity and that passion, the physical aspect is too weak. As the tamas side is concerned, the psychosis, which is inertia, which is laziness, ignorance, and which is goes to the little more pathological, more advanced level. And even the rajas and the tamas, all the miasm, when they have a uh, very integrated and a very complex phenomenon, the syphilis comes into picture. Now you see in tubercular miasm and the storic miasm, tubercular miasm mainly, the conscience is mainly the pleasure seeking. So the conscience is average. And in the psychotic and the syphilitic miasm, the conscience may be very poor in the remedies, which is like we have very refined conscience in the remedies like silicia, in the remedies like arsenic album, like the in the Materia Medica, the rubrics appear like guilt as if Summit committed some crime. Now, when these kind of aspects come into the now, where do you put the conscience in? It is in the cognition. The cognition, because the decision making is seen there. Now, the okay, the miasm part, we it's a whole different topic. Just I wanted to brush up that part little bit. So main focus is the essential evolutionary totality and understanding the disposition, that is the person in disease and not the disease. And you have to understand, as in the early formative years the mind is developing, therefore the learning disabilities and ASD and ADHD like phenomenon can intervene and in understanding the disposition itself, and you have to discount it while understanding the mental aspects of the disposition. And we have elaborated on the cognitive aspect in the children's group, how to understand that using a lot of educational psychology in understanding. Now, whole purpose of education is to able to enjoy the higher functions of the mind, those are neocortical functions, and that is the luxury human beings have over the other animals, and that is a human experience. And the limbic, the survival aspect of the mind help us survive and give that kind of protection phenomenon, but they do not overpower us and take charge of us, so that we're able to understand the experience the neocortical aspects. Now, if we the as Kapoor madam said in the morning, if we can get those red flags, signs, and understand this learning disabilities well in time, the homeopathy and the other remedial measures can help the child to enjoy the early formative years in a better way. Because if the lot of years go unattended with these learning abilities in the childhood, the critical sensitive period is lost in development. So it is my request for all of us to look for this kind of red flag signs in the pediatric population which comes across you. The parents have to become more aware about this and bring this to the notice of the pediatrician or the psychologist or the or the family doctor or your homeopathic physician, so that we can help the children be a better and more complete citizens in as a child as well as adults. Uh, I think this is it. We can go ahead with the question answer session.
Hello. Hello.
Yeah, Sonali madam.
Yeah, sir. The slides have ended. Your session. Any disturbance?
No, 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 no. Just we can go ahead with the question answer session. I think.
Yeah, sir. Just a moment. Yes, sir. I just want to say thank you to Dr. Sawant, sir, for such a enlightening and illuminating session, providing us the information about the efficacy or the role of homeopathy in treating the learning disabilities, along with the correlation of the study of different emotions and how different homeopathic remedies can be used in treating all the learning disabilities with the base of a scientific way. Okay, so now we can proceed ahead with the question answer session. So I would request all the audience to please put your questions in the chat box, so that with along with the name of the speaker, so that we can ask the questions to respective speakers. So we can start with the question answer session. Yeah. So I'll just start with the questions. Firstly, for Dr. Bharti Kapoor, ma'am. So, question for Dr. Bharti Kapoor, ma'am, is regarding the SLDs. Someone want to ask, ma'am, actually, when it can be diagnosed. Actually, they want to know what is the earliest age to diagnose the SLD, ma'am. Ma'am, is it
Yeah.
audible to you? Yeah,
Yes,
ma'am.
yes, dear. Uh, the diagnosis technically happens after the age of 8, okay, when the child can be certified as having specific learning disabilities. Okay, but the informal diagnosis can happen as early as 4 when the schooling begins, or even before that. You know, when we see that the child is unable to perform simple activities as buttoning. Okay, the child is unable to use buttons properly, or the child is able to dance, but when it comes to yoga, the child is not able to follow. So these are some of the signs that we have to consider, but the formal assessment will happen only after the age of 8.
One more question is that in the same correlation, ma'am, ki
Yeah.
what is when to start with the remedial approach in case of the learning disabilities, ma'am? In the same correlation, the question has been
Yeah.
asked by Varsha, ma'am. It is in correlation when to start with the remedial approach in case of the learning disabilities, ma'am.
Earlier the better, okay, always, okay, not in SLD, in all the disabilities, okay, and especially when it comes to autism, okay, I would like to make a special mention, because the early intervention has a very critical role. So with SLD, it will happen only when you understand the child is struggling with the academics, because it is a very hidden disability. So only if you see that the child is unable to perform academics well, that you will understand that the child has having certain issues with, the memory, the perception, and the attention issues. So it is as soon as you get to know that the child is facing certain issues, the immediate your response should be getting the child into the therapeutic model.
Yes, ma'am. Yeah. Should I ask the further questions, ma'am? Should
Yeah,
I
yeah, yeah, yeah.
continue?
Please,
Yeah,
yes, yes,
yeah,
yes.
yeah. I want to ask, ma'am. The question is, what precautions should we take to avoid the learning disabilities? The first means the first part of the question is this one, and the next part will be whether there will be multiple factors which will be affecting in case how to approach such kind of cases.
Okay, so I'll address the first one. What
Yes, ma'am.
precautions we take to avoid learning disabilities? Okay, so since it's a neurodevelopmental disorder, we cannot avoid it. Okay, we can just treat it well, the best we can do. So what precautions? Again, you have to see the early signs. Okay, early you intervene, early the better results that you get, and you cannot avoid learning disabilities. Okay, and it stays. It's a lifelong issue that the person will have to go through. So you have to make your own strategies when it comes to LD. You have to make your own strategies because it affects your personal life, if it affects your work life, it affects your family life. So you can best work, you can take the services, okay, available, the occupational therapy, the remedial education, the counseling facility, and make the best of what you can. Going to the next question, multiple factors. What I understand from this question is if you have a comorbidity. Suppose you have ASD and ADHD. Okay, so we take this example. Suppose a child has ADHD and a secondary diagnosis of ADHD. So in this case, let's take an example. Suppose parents come as, you know, the child is not sitting. Okay, when he is made to do his homework, he is not sitting. So in this case, if we see that the child is not giving eye contact, and we see that, okay, or if we get a case where there is a formal diagnosis done, okay, the child has ASD with ADHD, let us take this example. So we will see whether what is the primary concern. That if the child is not sitting, okay, what is causing the sitting intolerance? Is it the sensory issue that is causing the intolerance? Okay, sitting intolerance, or if the child has not well developed prerequisites for learning, for writing. Okay, the prerequisites for writing would be, you know, a good core stability, a good writing posture, you know, proper tripod grip, well illuminated room. These are the prerequisites for writing. If it is not available, and we are comparing it to the sensory issues, so we have to see whether it is a sensory issue that the child is having, or it is, you know, the lack of well developed prerequisites. So we will deal accordingly. So sensory issues, we will take the help of occupational therapy, and there is a lack of underdeveloped prerequisite, then we'll take the help of special education in this case. So it is case to case basis. We have to see what is the best for the child and what is stopping the child from learning. Yes. If more clarity is needed, please let me know.
Yes, ma'am. Yes. Ma'am, one more question is there. Actually, it can be taken by you also, means Kapoor ma'am also, or even the Samant sir also, because both the therapies can be used. Because one question is there, what learning disabilities, if it occurs in older age group due to any of the trauma or injury to the nerves or any other factor, what measures can be, or what intervention techniques can be used then?
Dr. Savan, can you we have your inputs on this? Then I'll.
If it is because of some trauma in the advanced stage, you mean to say, no? Can I get the question again?
Yeah. If the learning disabilities are occurred, have occurred in older age group due to any injury or trauma to the nerves, what can be the intervention measures we can take for?
Yeah, this will be a secondary to a neurological injury which has happened. Will be more. It's not as a primary learning disability. It is secondary to a neurological deficit post injury, and the age appropriate intervention has to be done. The complete regression of the development, as if it has occurred, then we have to start fresh, taking care like the stepwise, the educational aspects, and the help of the psychologist and other allied therapies has to be considered. The homeopathic remedy will definitely will help at the level of like secondary curative action to establish the balance in a better way. But it cannot be called as a primary learning disability, which is a neurodevelopmental disorder. It will be a secondary neurological thing, and definitely the because in the advanced age the appropriate learning time is lost. So the prognosis or the time taken for the favorable results will be more, and the yeah, that is.
Yeah. Yes, ma'am. Ma'am, would you like to put some inputs with consideration to the
Yeah.
remedial measures taken?
Considering this example, the person would have to take rehabilitation services. Okay, so the rehabilitation would be, around occupational therapy, because the person would require, services to get back to their regular life activities. Okay, because it's a brain injury, because the incident has happened because of some brain injury. So and then some counseling will definitely be required, because there will be a lot of, psychological distress that has been created for the person in this situation. So that is it.
Should I proceed ahead with two, three more questions? So then we
Yeah.
can end with it. Yeah, one more question is that nowadays, due to the online classes and all, some might have asked this question: ki how we can relate the mobile addiction or usage of the excessive screen time and its effect on the learning disabilities to ma'am actually.
uh, the effect of screen time on learning disability.
Yeah, yeah, yeah.
Yeah, this is a question. Okay. So the effect of screen time is affecting everyone, not just, children, people with learning disability. It is affecting everyone as such. So when it comes to children with learning disability, because they are more prone for, they are very easily influenced by the environmental factors. Okay, so then we have to, the best solution in this would be, getting into the counseling mode. Okay, because they have certain behavior issues, they have aggression, they are gullible, so we have to consider everything. Only by this, simple ki how say screen time zyada ho gaya and it is going to affect his learning disability, we cannot conclude it here. We have to see what are the other factors that are affecting the child, whether it is the parental involvement, whether it is the motivation that is getting affected. The studies, the child doesn't have any study skills, so he is getting into, more of screen time. So we have to see, we have to have a clear picture of the uh, situation to provide any guidance on this.
uh, the question is, can certain behavioral traits of a child can be correlated to the learning disabilities? For example, stubborn behavior of the child, obstinacy of the child. To ma'am, this question
Yeah,
is.
yeah. So we have to make it very clear here that learning disability is a hidden disability. Okay, looking at any child or a person, you cannot say that the child, unless the it is on the severity level, it is on the severe high grade 3. Okay, if it is on a mild spectrum, then you will not be able to you know uh, say the child has a learning disability. So can you ask who has put in this question? Can you ask the person to be?
Yeah, yeah. Just a moment, ma'am.
Yeah,
Uh,
ma'am.
Isha, ma'am.
Hello. Am I
Yeah,
audible?
yeah. Yes, yes, dear.
Yeah,
Yeah, yeah.
yeah, ma'am. I just wanted to know that whether, like in one of your case report one, where
Huh.
you mentioned about the stubbornness of the child was there, and
Hmm.
case. So exactly in that case related only, I wanted to ask, okay, how can we correlate in that case? Case stubbornness is anywhere related to LD.
See, only considering stubbornness, you have to have a complete case history in this case.
Yeah, ma'am.
Okay, so your first background you have to check is the academic background, because learning disability is definitely affecting the child's academic skills somewhere. So,
Okay.
you can go through asking like, has a child failed in any of the subjects, in the past, or in any particular subject the child is failing,
Right.
or so you have to have a complete case history. Just following one of the behavior concerns, you cannot say that the child will has or will develop learning disabilities.
No,
They
it can
have
be
to.
an expression, right? It can be an expression of the learning disability.
Yeah, it can be an expression of learning
Expression.
disability. Yes,
Oh,
yes, definitely. Okay.
okay. Thank you, ma'am.
Yeah.
No problem. Thank you.
is for Sawant sir actually. Can we say that delayed milestones like delay in neck holding or likewise delay in crawling, it can be related in future to SLD?
No, not really. Because delayed milestones, delayed neck being can be delayed milestone per se, and it can have various background conditions like MRCP or various other conditions. But as Madam said, learning disability is a hidden condition. It will not have other milestones delay which are likely to have other etiologies. So no.
Yeah. Last question for Kapoor ma'am actually. Whether there are any special allowances for SLD children in colleges and what how they can function in the outer world after completion of their matriculation.
Yeah, that's a good question. There are provisions. Okay, so that is the that is the reason I was emphasizing on the certification process. Okay, every now and then, because there are allowances till your graduation, even your post graduation, even your entrance examinations. Okay, so if you're preparing for your entrance examination, there are provisions for children with SLD and autism. So, and the next part is how can they function in outer
Yeah.
world after not just matriculation, you can have other further higher studies as well. There's no issues. Children with specific learning disability, if you are on the mild and moderate spectrum, you can continue, you can go to your higher education qualification, absolutely no issues. Here I would like to mention that Xavier's College, they have especially for visual impairment, they have a braille library. They develop their textbooks in braille. So there are certain colleges we are taking extensive care about the children with special needs.
Yeah. Then last question for Sawant sir actually. Question is that what is the role of heredity in development of the learning disabilities or SLD, and how we can correlate it with homeopathy when such a child has come to a homeopathic physician for treatment?
Empathy is concerned, the hereditary
Yeah.
uh, background, we speak of fundamental miasm. Like hereditary background is the genetic material, the genetic heritage that the child gets from the parents, and definitely it being a neurodevelopmental program, neurodevelopmental disease, heredity like genetic predisposition has a very major role to play. And while considering the totality, will give due importance to this aspect in terms of fundamental miasm, in considering the miasm understanding and the uh, either covering that miasm in the remedy itself, the remedy it's covering that miasm, then it's fine. Otherwise, we have to give an intercurrent anti-miasmatic remedy to cover that miasm. So the genetic predisposition has definite role to play.
I hope all the questions have been answered very well by both the speakers, actually. So, thank you, Dr. Sawant sir and Dr. Bharti Kapoor madam, for clearing out all our doubts and questions in a scientific way. So, now moving ahead further, now I would like to invite the chairperson of today's webinar, Dr. Prachi Uttekar madam. Madam is HOD from the Department of Pediatrics at Dr. G.D. Paul Foundation, Yadla Homeopathic Medical College, Kharghar. Ma'am is also PG guide, and she has got 10 years of clinical experience in especially in pediatric cases to treat successfully with homeopathy. So now I would like to welcome Dr. Prachi Uttekar ma'am for addressing her speech for this webinar for chairperson's address. Yeah, thank you, ma'am. I'm handing over the mic to Dr. Prachi, ma'am.
Thank you, Dr. Sonali. A
Yeah.
very good afternoon to all the participants of this webinar. It's been an honor to be able to present my perspective before you all in this webinar. Today, we have experienced a quite stimulating session by our distinguished speakers Mrs. Bharti Kapoor ma'am and Dr. Vinod Sawant sir, who have thrown light on the important aspects of the learning disabilities. Previously, learning disability was considered to be a problem in the Western countries, but now the scenario has been changed, and more cases of LDs are getting identified, and the awareness has increased. It has been seen that 5 to 15% of the school-going children are identified with the learning disabilities, and in that, the proportion of dyslexic children are majorly seen. Now, LD is the one has been found as one of the main reason for the school dropouts and lack of interest in studies and the poor academic performance. And there is a strong association between the ADHD and autism spectrum disorder with the LDs. So when we will actually when we will impair, and this will actually impair the process of learning for our children. So it is said that education fails if it doesn't prepare a child for a community living. So it is crucial to have a good system of screening and identification and assessment and remediation in this particular area, and so that the children will get equipped for the better. And considering this, our first speaker, Mrs. Bharti Kapoor ma'am, has highlighted the important clinical aspects in diagnosing the learning disabilities and the autism spectrum disorder and the ADHD also. So how to differentiate these two things with the learning disabilities, and what are the different modes of intervention plans which are been discussed in the session. It will require a multidisciplinary approach while handling such cases. It will require a parental counseling, that is very much important. Madam has also stressed upon the remedial education, which is the main treatment line of treatment for this the learning disabilities, that is multisensory approach and individualized education program. So this the first session followed with the has also included the case studies which were quite helpful for the PG students to identify and diagnose the learning disabilities. The second session was taken by our own uh, uh, sir, that's Dr. Vinod Sawant sir. He is associate professor in the Department of Materia Medica. He's beautifully explained the correlation of the personality and the homeopathic aspects with the by taking the help of the EET, essential evolutionary totality. He has stressed the importance of predisposition, disposition, and diathesis, and he has also stressed upon the intelligence modalities and how these intelligence modalities are correlated with the remedies, homeopathic remedies. So, and at the end, in order of the importance, he has given that we need to, while treating such cases, we need to consider emotional modalities, the positive modalities, the emotional state, and the spontaneous behavior and symptoms of the intellect. So, keeping this in mind, I think I'm sure as a homeopathic physician, we will definitely use our today's knowledge and will implement in this our clinical practice, and which will definitely help in improving the health status of the children and quality of life of these all these learning disabilities children. Okay, thank you so much.
Yes, ma'am. Thank you, ma'am. Thank you, Dr. Prachi Utekar, ma'am, for your valuable inputs and giving us the insight about today's webinar. Now, it's time to move ahead, that is to end the session, end of the webinar. Here, I would like to say that the success of today's webinar is a fruitful result of efforts of many, not a single person. And now it's time to express our gratitude to each one of them. The first and foremost, I would like to express my gratitude to our esteemed chairperson and chairman of Yerla Medical Trust, Dr. G.D. Pol sir, for his valuable support and guidance, and providing us such an opportunity for all of us, so that we can stand ahead and prove ourselves what we can do. Then I would also like to express my gratitude to Principal Dr. Page Madam for such a motivational support and always guiding us to organize such events. Then I would also like to express my gratitude to our Vice Principal and Dean Faculty, Homeopathy, MUHS Nashik, Dr. Bagal sir, for his valuable contribution and inspiration to all of us to carry out such brainstorming activity and sessions. Now, I also want to express my gratitude, and I would like to say thankful to both the speakers of today's webinar, Dr. Bharti Kapoor Madam and Dr. Vinod Sawant Sir, for their valuable time sparing and enlightening us with such a valuable information which will be proving beneficial to all of us in our future. I would also like to extend my gratitude to the chairperson of today's webinar, Dr. Prachi Utekar ma'am, for her valuable insight and input for today's webinar. I'm also expressing my gratitude to our PG coordinator, Dr. Bhagwat ma'am, for always providing us the constant guidance and support to carry out such golden opportunities. Then I would also want to say thank you to Dr. Shakir, Assistant Professor from Repertory Department, and Dr. Dhanraj Mistry Sir from Department of Pharmacy, and Prashant Godse Sir and his IT team for the technical assistance. Now it's time to say thank you to all the teaching and non-teaching staff. And last but not the least, it's time to say thank you to all the audience for their patient listening and such a participation, enthusiastic participation in today's webinar. So in the end, I just want to say thank you to all of you for nice cooperation and patient listening. So I would say thank you to all. Thank you.
Thank you, ma'am.
Thank you, ma'am. Leave, Guru.
We can leave now, ma'am, right?
Yes, ma'am. Yes,
Yeah,
ma'am. You
yeah.
can leave.
Thank you.
Yeah.